DIV ozone injections. This is the topic of my live stream today. So I hope everyone can hear me if anyone is logged in. So today I will give a report on the known cases of people who have done DIV ozone injections and what experience they have had with those injections. So basically this is to serve as an inspiration to people who are thinking about either getting DIV ozone injections done or performing them themselves. So I'm Paula, the crazy ozone lady, and before we start, it is important to note that this is not to be misunderstood as medical advice. So if you're sick, please go and see your doctor. Do not consult videos of self-proclaimed ozone ladies for your health problems. And also it is important to note that I'm not claiming that ozone therapy or specifically DIV ozone injections that are any type of cure. In all the cases I will be presenting, those are case reports, those are anecdotes, those are subjective reports of people and patients and doctors, and so there were nearly always confounding factors. So in most cases the patients also took drugs or combined them with other medications or supplements. So in the end it is not entirely clear what had the effect, except for the varicose veins. With the varicose veins that I will show at the end, so I will show before and after pictures, it's pretty clear that this was really the effect of only the DIV ozone injections and nothing else. All right, so let's begin. So the most amazing story when it comes to DIV is, of course, what Dr. Rowan and Dr. Robbins accomplished a few years ago in Africa. So in 2016, Dr. Rowan and Dr. Robbins, they went to Africa, and there was also Dr. Carew who was involved and a few other people who helped put this reports together. And so this was during the outbreak, the Ebola outbreak. And so they trained, Dr. Rowan and Dr. Robbins, they trained doctors, African doctors, and those African doctors, they went on to treat Ebola patients. So it was not Dr. Rowan and Dr. Robbins who themselves treated the Ebola patients, but it was the African doctors who they had trained earlier who performed the treatments on the Ebola patients. And so later their work resulted in this case report. So those are actually 5 different case reports. So the first case report, very interesting here. So one physician, he got pricked by a needle which was contaminated because of blood from an Ebola patient, and then he later developed symptoms like fever, loss of appetite, unusual bowel movements. The urge was very strong. He then immediately took drugs, so different antibiotics and paracetamol, and he also performed DIVs on himself, from what I understand. And in total he did around 1, 2, 3, 4, 5, 6, at least 6 DIVs of various amounts and concentrations. Here one time 30 cc at a concentration of 55 micrograms per milliliter, then 36 micrograms per milliliter, and he completely recovered. But it is important to note that no test was performed. So we don't actually know whether that doctor had Ebola or not, but it is very likely because of his work and because of the symptoms he developed. Then the second case, that was actually a confirmed case, that was also something that was in the news in Africa. So this was something that the government publicly announced, that this case was a complete Ebola recovery, because that physician tested first positive for Ebola, then he did DIV ozone injections, and then later the test was repeated and he tested negative. So this is a very strong case that indeed DIV ozone injections were the deciding factor why the patient recovered. But in this official announcement by the government, ozone therapy was not mentioned. Then another case, here it was also a male nurse who was working on the Ebola front line, and he did not wear protective gloves, or the protective gloves were damaged, and he came in contact with blood from an Ebola patient, and then that male nurse quickly developed fever, malaise, and headache. He received 2 DIV ozone injections of 20 and 30 cc respectively at 55 micrograms per milliliter and drank ozonated water on 3 consecutive days. Upon testing positive for Ebola virus, he was taken to Kerry Town Ebola Treatment Center, where he was not permitted further ozone therapy. However, he had a complete and non-complicated recovery. So this was also a pretty clear case, in my opinion, that DIV ozone injections most likely were the contributing and main factor why this person recovered. And he also tested positive. But given that he was later transferred here to this Kerry Town Ebola Treatment Center, it is very much possible that he was also treated with some drugs while at the center. So again, one could make the argument, it's not really clear, was it the drugs or the DIV ozone treatments which helped with the recovery, or maybe it was a combination of those two things. So the next case was also someone who tested positive, and it was also another person who was working with Ebola patients. He got contaminated through bodily fluids from an Ebola positive person, and then he started developing symptoms of extreme fatigue, body pains, and vomiting, and he immediately took anti-malarials. Then he was started on DIV ozone 40 micrograms per milliliter, 40 cc's. And here this is very interesting. Within a few hours of the gas injection, almost all symptoms subsided. And this is, of course, something that is not unusual. Anyone who has treated patients or treated himself with DIV ozone injections knows that this is actually not something that is rare. With DIV ozone injections, one can really produce immediate, really powerful, positive effects. So he started the DIV ozone injections, saw immediate resolution of the symptoms, or the symptoms subsided. He also drank ozonated water. He was symptom-free, but because he then tested positive for Ebola, he was placed in a treatment unit where he could not continue with the ozone treatments. But he had an uneventful stay at the treatment center and then was discharged and fully recovered. And then the last case, this was of a female companion of a doctor, and that physician, he was confirmed to have Ebola virus disease, and he also died of that disease. And she says she had intimate contact with him, so she expected to also be infected by Ebola, but was placed under home military quarantine. So there were actual military guards in front of her home, so she could not leave. But anyways, she was so desperate that she escaped. So she scaled a razor wire fence, hurting herself, evaded the guards, and then went to a facility where she knew that she would be treated with DIV ozone injections, and that was performed for 10 days, and she also received vitamin C and Thiodox twice daily. No symptoms developed. So it is not clear here whether the person was positive for Ebola. It doesn't even seem that she ever had any symptoms, so it seems that she also only did this preventatively. But in any case, she never got sick, so it's very much possible that the DIV ozone injections were the deciding factor in this. All right, let's move on to the next thing. So here is the story of Debbie, who shared with me her experience with using DIV ozone injections for that thing that was going around, that's still going around, that I will not mention, otherwise the big tech thought police will become angry and shut me down or put a disclaimer underneath my video, who knows. But anyway, she thinks she caught that infection. She was never tested, she never tested positive, but she says all her symptoms matched, and she is absolutely convinced that she caught that virus. And she says, here also, she says that she tried other treatments first. Okay, so she tried vaginal insufflations, rectal insufflations, and cupping, and even nebulizer, and she said none of this helped, and that the only thing that really helped was DIV ozone injections. And here she says, first day the DIV gave immediate relief to breathing, and hours later to inflammation. My lungs and body so inflamed, barely could move or breathe. Plus at most all the other symptoms, and it's a long list. But first DIV went straight to lungs, and I was having huge issues with breathing, and it rescued my breathing immediately. And in our time, inflammation, pain of lungs that were headed to pneumonia calmed. So this is something that Debbie experienced, and she also shared this with Dr. Rowan, and she is convinced that actually DIV ozone injections helped her survive this very severe infection that she experienced. Here is something that Dr. Rowan reposted on his Facebook wall. This is actually a message that Dr. Robbins received, and Dr. Robbins forwarded this to Dr. Rowan, and here he reposted this. So here again, someone who says, I was having significant shortness of breath, and other than ear and water treatment, had not done any other treatment, hoping it would just resolve itself. Yesterday, after watching a video interview you did in regards to DIV treatment being the best method, I did one yesterday for the first time in over a year. I went to bed last night still feeling tight in the chest, but I woke up this morning feeling at least 80% better. I will probably do one more treatment today, but I am convinced that DIV did the trick to knock out the COVID virus. Oops, I said it. And it did so very quickly. So yes, again, someone else who has reported amazing results with DIV. It was overnight, he did one DIV, next morning woke up 80% better. Again, anyone who's ever had DIV ozone injections done is not surprised. Then we also have here Dr. Olmedo. Dr. Perez Olmedo is a Spanish oncologist, so he specializes in cancer treatments. But around 2 months ago, he came down with a severe infection, and he is also convinced that it was that thing that was going around that I'm not going to mention. And what did he do? He treated himself mainly with ozone. And what exactly did he do? So he did rectal ozone insufflations, but also direct IV ozone, 100 milliliter to 40 micrograms. I assume he means micrograms per milliliter with sandwich technique, which I'm not sure what this is. And also other ozone treatments. But yes, Dr. Perez Olmedo is also a believer in DIV ozone treatments. He later performed a test for the thing, and the test came out negative, but he is convinced that it was the ozone treatments that caused him to go negative. So he is convinced that he actually was positive, did the ozone injections, including the DIV, and that it was the ozone treatments which caused him to overcome that infection and then to test negative. All right, let's pull up here another story. So this is someone who has recently posted this in the ozone group. So he is suffering from chronic Lyme symptoms, and he says, I don't want to jinx myself, but the past 2 weeks I have not had any major chronic Lyme symptoms. My energy has come back and I feel like I got Lyme on the ropes and I'm not letting up. I've been doing daily DIV, about 30 to 40 cc at about 35 to 40 gammas for about 1.5 months. And also he is combining this with rectal insufflations and ozonated water. So this is another positive report and shows what can be accomplished even in chronic Lyme disease. Here is also a very interesting case. So this person, he gave me permission to share this. By the way, I'm not sure how to pronounce his name, Mustafa Aga. So he has a disease, it's called Behçet disease. And this disease, this is basically one develops a lot of inflammatory symptoms, and the inflammation that can cause ulcers in the mouth, in the genital region, and in the eyes. And also arthritis can be also part of the complex of symptoms that this disease causes. And Mustafa here says that he's done 8 sessions of DIV ozone injections, and in that time he has seen blood pressure getting normal, he sees hair loss stopped, and chest tightness is less. Well, this is not unusual, as I explained earlier, that with time, the more DIVs one performs, that the chest tightness becomes less. And he says, and the most important thing, that Behçet disease has been stopped. So this is extraordinary because officially there is no cure for Behçet disease, but it's not sure whether that was a cure for Mustafa or whether he will have to continue with the ozone treatments. So what else do we have? We have also DIV ozone injections and herpes infections. So here is someone who also posted this in the ozone group, and this is a test which shows no serological evidence of HSV type 1 and 2. And so what was performed, what kind of treatments? This patient has a positive test originally and outbreak 6 months ago. We did IV ozone, and although it's not specified that it's DIV, I know that it was DIV ozone. Minor autohemotherapy and vaginal insufflations, 9 sessions total. And so here there's also something very interesting that I found. So there was actually a study performed. Well, it's less of a study, it's a collection of cases. And so this was performed in Italy. And so what was done here, this is from 1982, it doesn't say here, but it's from 1982. The interesting thing here is that this seems to be the only English translation on the internet. So this website here, ozonetherapiesgroup.com, this seems to have the only available English text of this study, and the original is in Italian. And so what is interesting that apparently here DIV ozone injections were performed in patients with herpes simplex and herpes zoster infections. And this is really extraordinary because we know that thanks to Professor Bocci, the Italians are extremely critical of DIV ozone injections, and consequently DIV or direct intravenous ozone injections are not specifically mentioned here in the text, but it is clear that this is what must have been performed because of the following description here. So here under material and methods, so here it is described what they were actually doing. And it says here, therapy performed in all patients consisted of injections of 20 cc of oxygen ozone mixture. The concentration of ozone was 20 gamma of ozone. Injections were performed daily and were stopped at complete healing. And the critical thing here is here where it says some patients sometimes noticed a sense of gurgling at the axillary region. 5 patients had a slight cough for about 10 minutes after injections. So this here, this makes it clear that those patients were actually treated with intravenous ozone oxygen injections, because what is described here, gurgling at the axillary region. So the axillary region, this is the armpits. This is here, this region, and this is something that is typical for DIV ozone injections. So when you perform a DIV ozone injection, you can actually hear and you can feel kind of like a bubbling and gurgling sensations here in this region. And of course also cough. Cough is also something that is typical for DIV ozone injections, or chest tightness. So although they're not saying anywhere in the text that this gas mixture was introduced intravenously, it is clear from this description that this is actually what they must have done. But what is also important to note that this was not a study in this sense. This is more a collection of case reports, and the reason why I think this is because of the length of this study that was done here, which went over 2 years, and they said basically that all patients recovered. So this is it's clear that this is a collection of testimonials, or this is a collection of case reports. This is not really a study where different interventions were compared with each other. But it is, nevertheless, it is an important collection, an important or a valuable source of information, in my opinion. So when you go to the results, so what they say here, that in all patients, healing of skin lesions were observed after a minimum of 5 and a maximum of 12 ozone injections. So 100% healing in every patient. So this is another indication that this was not really a study, but as I said, this is really a collection. So it's kind of like a cherry-picked data, but from this information presented here in this thing, you can't really draw any conclusion how effective DIV ozone injections are for herpes viruses, but you can only see that in some cases they are effective. But in what the percentage of cases are, it is not clear. But anyway, so between 5 and 12 injections were needed to either resolve herpes zoster or herpes simplex symptoms. And it's also here not clear, unfortunately, whether they mean herpes simplex 1 or 2, but it could be potentially both. So it's still something that is quite inspirational. Okay, so let's go to something that is probably pretty mind-blowing. It's mind-blowing to me, and that's, although I have performed this and I have seen the effect of DIV ozone injections, this is what one can do with DIV ozone treatments for varicose veins. So this is one of my patients, and you see here before and after picture. And so you see here a well-formed varicose vein, and here also in this area. And this was, I don't recall exactly, but this was unusual because it needed a couple of treatments. So I think it was either after 2 or 3 treatments that we saw this result here. It is unusual because usually you really just need one treatment for varicose veins. This is here also the same person. I believe it is the same leg, but from another side, and you see, so there were some additional varicose veins, or maybe it was the other leg, I'm not sure. And you see here also it looks much nicer. So basically all this here, all those bulging ugly blue veins, they are here completely gone. Okay, let me show you a couple more. So this is also someone I treated. So this, you see here a bulging varicose vein here at the shin, and this is here the after picture, and this is just after one treatment, and this is all it took. So this didn't have to be repeated, and this is years later that the vein, the leg still looks like this. Okay, let me show you something more. So here's another case. This is another before picture. You see here really ugly bulging blue veins. Then we have here This was after, I believe, 1 treatment, so you see already considerable improvement. So you see here the bulging is less. And then we also took care of this here, this was more a spider vein. And then after another injection, the leg then looked like this. So you see here on complete resolution of all the bulging ugly veins that were here, and also here this pronounced spider vein also improved greatly. Now I do recognize that there are different light conditions here, but really the leg looked much better after, I think it was 2 or 3 treatments. Now this is another picture from another side. You see here was a pronounced big bulging varicose vein that went all the way down here, and I injected the vein somewhere around this spot here, and this took care of the whole length of the vein. So the injection was around here and it took care of the whole vein here, this whole area here. So again, so you see before and after, really amazing results that one can accomplish with DIV ozone injections. So DIV ozone injections specifically for varicose veins, they really render amazing results. So this is, in many cases, this is just like a one type of treatment. If you use a high enough concentration, then it will really knock them out in one treatment. Sometimes, rare cases, you need to repeat the process, but in many cases, it's just a one time if you use the right concentration. So I hope this was informative. Let me know if you had any experience with DIV ozone injections, if you like them, if you don't like them, if you like other treatments better, if you're scared of DIV ozone treatments, if you're scared, why are you scared? Tell me all about it in the comments. Also check out the description below the video. There may be some interesting stuff going on there. Also subscribe to my newsletter. And thank you very much for watching. Thank you very much for listening. As usual, do something good for your health. Go eat a piece of a dead animal. See you in the next video. Bye.